Hello, my name is Kristina Julich. I'm a pediatric neurologist. I've always enjoyed working with children and being around children, and on one side and on the other side, I was always very interested in biology, biochemistry, and so I think going into medicine was somehow a natural way to combine this. Neurology and child neurology is a field that's rapidly changing, and we're learning so much more about the brain, and yeah, I think it's just really, really interesting. My specialty or subspecialty within the field of pediatric neurology is neurogenetics, or epilepsy genetics in particular. I think when we think about epilepsies 20 years back, most of the epilepsies were called or considered to be idiopathic, which is basically another term for we don't know what causes it. And we've learned so much in those 20 years. We now think that probably the majority of epilepsies are genetic. And we're starting to learn much more about the mechanisms and which genes are affected. And there are certain tests that we now are starting to offer to people with certain types of epilepsy. And we're even starting to learn there are certain types of epilepsy where certain medications, based on the genetic test results, certain medications may work better or may be contraindicated. I think it's the biggest part, the most important part of forming a relationship with the parent and their child as well. And I think I have the great luxury here of being able to take time to listen to them. Because I think, especially that the very first visit, I think that's the most important. Listen to what they have to say, what their main concerns are. I really enjoy interacting with the families and their patients. I think that's the most rewarding. Seeing the kids in the office, seeing the kids be happy in the office as well. Sometimes they're scared when they first walk in, but then they kind of warm up and you play with them, and then they're super happy as they walk out. I really, really like that. I have 2 young children, so I think my weekend activities evolve a lot around playgrounds and pools.